In rheumatology, many patients are managed as outpatients. Many patients are seen in the outpatient clinics, and it's worthwhile taking a few moments to reflect on issues around the outpatient visit, on issues that might help to make the outpatient visit for the patient more pleasant and efficient, and for you more of a learning experience and more directed. This presentation involves looking at the aspects of the outpatient visit. In later presentations, I will look at specific details related to specific diseases. This presentation concerns issues around a review patient visit in rheumatology. Now, the first thing to know about this sort of a visit is that it is a learning episode for both you and for the patient. You to learn about the patient and their disease, and the patient to learn about their own disease. It's also got a service function in that this is one of a number of visits each patient will make concerning their disease. And the object of the exercise is that each of these episodes is aimed at restoring the patient's health or stopping progression or getting the disease under control. The initial contact at the visit should be one of greeting, where you introduce yourself to the patient and greet the patient in a warm and pleasant manner, so that you set the tone for the visit. A positive attitude from you and a pleasant mood from you transfers to the patient, and this has obvious consequences in the whole visit. Now remember that even though this may be one of many visits you will be involved with on any particular clinic, for the patient it is a highlight of their day often, and often the highlight of the week or the month. And so you must see the visit from the patient's point of view as well. It's worth reflecting on at the beginning, what is the purpose of the visit? Now, many visits are merely a routine review where there are not many issues involved. The patient's disease is under fairly good control and there's very little active intervention to be undertaken. Now, if that's the case, then the review should fit into this sort of a template and you can get through it with efficiency and with completeness. Some visits are by way of review of changes, where at previous visits the treatment or the disease has changed, and we then have to look at the patient to see what is the result of these changes. So early on in the visit, check the notes of a previous visit for the plan from previously to get a sense of what the treatment progression has been. If a visit has been brought forward, then it's important to note this and to see what has happened, who changed the appointment and why, because this is obviously an important starting point with regard to any particular encounter. Next, look at the disease and get an overall impression of the disease, a diagnosis if it has been firmly made and why it has been made, or if a diagnosis hasn't been, then the differential diagnosis and the thinking of previous clinicians with regard to this patient's disease. Have an idea of the duration of the disease and have an idea of what sort of severity markers and activity markers might be used in this particular disease. Next, look at medication. Now you want to know from the notes what the patient should be on, from the patient what they are actually on. Have one or two questions with regard to compliance to reassure yourself with regard to compliance, and then correct the note so that they are an accurate record of what the patient is actually taking. If there have been any recent changes in medicine, either at or since the last visit, then they should be noted, and the effect should also be noted. Next, look at the current status of the disease, whatever that be. So review the actions from the previous visit and how that has been planned and noted. Review the disease variables, and that varies from disease to disease. Ask about any new problems. Look at the results of laboratory tests that have been undertaken at or since the last visit. And look at the imaging to see whether there is a need for new imaging, and if so, imaging of what. Now, in patients with peripheral arthritis, the number of painful joints, the duration of stiffness, and the number of swollen joints can either be noted casually or on a score to give an indication of the patient's disease activity. There are formal joint counting strategies and visual analog scales that can be used for this purpose. Aside from these more routine and well-documented measures of disease activity, there may be other different problems. And so one needs to look at the patient's previous problems and see that they're updated as regards progression, and identify any new problems that need to be dealt with at this particular visit. And then construct a plan to deal with the patient's disease, its activity, its severity, and the particular problems. So you look at these as they have been presented to you, make any medicine changes, construct a provisional plan if needed, decide what laboratory tests need to be done, what imaging needs to be done, if any, and then communicate these changes. So for a doctor in training, it is important that the plan that they have constructed be discussed with the senior colleague so that the learning function of the clinic is fulfilled and the patient gets the optimum service. So you discuss your provisional plan, your findings and assessment. You talk to the patient, write to the GP, and write to the GP in the knowledge that the letter you write is a record of that visit. So the letter should contain the usual demographics, a diagnosis, then the subjective features, in other words, the disease from the patient's perspective, objective features, the doctor's findings, an assessment, your overall assessment of the patient, and a plan that has been approved between you and the senior colleague. For the patient, it is often useful to take out a small piece of paper and write a note with regard to the changes in medication, any other changes in management, a note of the next appointment, and any special instructions. If one sees a review patient visit in a template like this, then we can work through a framework that allows you to be methodical and complete in how you carry out the visit. And with a template like this, it is possible, therefore, to concentrate on your relations with the patient, the pleasantness, the communication with the patient, so that they obtain the maximum value from the visit. So that covers not all, but most of the aspects of an outpatient visit in rheumatology. And I will leave you now with a checklist of the more important and salient points, which may serve as an aid memoir to help you in your practice.